Long-Term Services and Supports monthly public webinar. Very excited to have you all here today. We have a full set of panelists, and we're going to cover some of the federal stimulus funding and its impact on older adults and those with disabilities. We're also going to have a great responder panel to talk about some of the ideas and suggestions for how to use some of this enhanced funding. And then we will go into a discussion of the LTSS gap analysis that DHCS will be conducting in the upcoming year. And then we will have an update from Alive Ventures on some of its Elder Advisory Committee work. So nice packed agenda, glad to have you all here. And we will go ahead and jump right in. We have a quick change to the agenda that was sent out. Jennifer was called into a meeting, and so Martha Egan has been nice enough to join us this morning. I'm really excited to have her to talk about the federal stimulus impact on California's older adults and the disabled population. Martha is the Technical Director for the Division of Community Systems and Transformation at CMS, and we're lucky to have her joining us this morning to give a quick overview of some of the work that's been happening that I know you all have been monitoring closely as those federal dollars come in to support the work that you all do. So I will go ahead and pass it off to Martha.
Great, can you hear me?
We can.
You know what, I have to apologize. I think I'm gonna have to stay off my video. It just knocked me out. So when it's a little bit of a technical issue, and I don't want to get knocked out of the video again. So I apologize.
No worries.
Yeah, so well, again, thanks for having me, and I'm sorry that Jen couldn't make it today, but she did ask me to come to the meeting and provide some updates on some recent federal activity and funding related to HCBS. And this would include the reauthorization of the Money Follows the Person demonstration, which the reauthorization occurred under the Consolidated Appropriations Act of 2021. And also, Jen asked that I talk a little bit about Section 9817 and Section 9813 of the American Rescue Plan Act of 2021. One thing to note about those two provisions under the American Rescue Plan is that CMS is really actively working on guidance for states. So we have a limited amount of information that we can share right now, but certainly once that guidance is out, CMS would be really, happy to talk about those two opportunities at any point in time. So let's just start with MFP, the Money Follows the Person program. I think as most folks know that the MFP program, it really has been a very long-standing federally funded grant program. And it was actually originally authorized back in 2005 under the Deficit Reduction Act, and I'll just refer to that as the DRA. And the goal of the DRA was to support states with rebalancing their long-term services and support system, and also to provide Medicaid beneficiaries who were residing in institutions, or who are, providing them with the opportunity to transition in the community and to receive their services and supports in communities and homes of their choice. So since the start of the program, which actually occurred in 2008, and that was a period in time when the original MFP grantees came on board and began to plan and implement their demonstrations. And then through the end of 2019, the program has transitioned over 100,000 individuals from institutions to community living. And right now there are 34 states that are participating in the MFP program. And over the last couple of years, the demonstration has kind of been operating on a series of short-term funding extensions. Originally, the funding was through the year 2016, and allowing states to continue the program in 2016 and 4 additional years. And what that meant was that really by 2018, the MFP demonstrations were kind of in a wind down mode, or thinking that way, right? And beginning to close out the programs. But all of a sudden, the MFP demonstrations started to receive some short-term funding extensions. And In December of 2020, the demonstration actually was reauthorized through federal fiscal year 2023 under the CAA, or the Consolidated Appropriations Act. So this has given, sort of a longer term funding kind of landscape for the program now. And it has appropriated an additional $1.2 billion for the program. And it also, the CAA, under that reauthorization of the demonstration, also has a couple of statutory changes that really do impact the MFP demo. One of them, and most notably, is a new statutory provision that reduces the minimum institutional stay requirement for MFP eligibility from 90 days to 60 days. And it also amended the DRA to allow short-term rehabilitative service days in a skilled nursing facility to be counted toward the length of stay requirement for MFP eligibility. And what these statutory changes do is they really do allow the MFP programs to provide community transition services under MFP at an earlier in eligible individuals' inpatient stay. And certainly, I think certainly states are expecting to see an increase in the number of MFP funded transitions to the community with the statutory change. And, for example, we think that individuals who are in an institution for 60 days versus 90 or longer may have a better chance of holding on, retaining, or preserving their community housing. So whatever community housing that they came from prior to going into the institution, we're certainly hopeful that they will have a better chance of holding on to that community housing. I think folks are well aware that housing was considered, the biggest barrier back in 2008 to transitioning individuals out of institutions, and it still remains quite a barrier for individuals moving from an institution to the community, finding, locating, securing affordable and accessible housing. So, and these changes, these new statutory changes on that institutional stay requirement, those actually became effective in late January, I think January 26th, and that was right after, 30 days after the CAA was enacted. So states can retroactively implement that change at this point. But not only did the CAA provide some of these statutory changes on the eligibility requirements for MFP participants, but it also did authorize CMS to expand the MFP program to additional states. So new states will be allowed under the CAA to join the MFP demonstration. There's a couple of new requirements that states will have to work towards. One of them is the CAA did establish a new work plan. There's some additional requirements around reporting under the TMSIS, or the Transform Medicaid Statistical Information System, for new and current grantees. Another big provision or piece of the CAA legislation, it did provide funding to support quality assurance and improvement. And this includes some oversight, technical assistance, and also research and evaluation activities. And under the evaluation, it does require CMS to submit a best practices report to Congress, and best practices around the most effective strategies and services that MFP demonstration programs were able to implement, and those types of services that they have either sustained or will be sustaining in their regular state Medicaid program. And also the final evaluation does require CMS to submit a report to Congress, and that will be due at the end of the program. By the time states will have kind of completed their transition programs in 2026, and that best practices report is due in end of 2023. So we are really in the process right now of implementing all these changes. And certainly we'll have more information to share with you in the future. The other thing under the MFP program is that CMS did provide, this happened back in September, we did provide states or current active MFP grantees and an active MFP grantee is a grantee who is actively transitioning individuals under the MFP demo. We did provide these active MFP grantees an opportunity for up to $5 million for planning and capacity building activities to really to kind of accelerate and advance LTSS system transformation, design, and implementation, and really to help states come up with initiatives and strategies and fund these to expand, enhance, or strengthen their HCBS systems. And states have until the end of June 30th, to submit their funding requests. And so we are starting to see numerous initiatives, proposals come in, and certainly hopeful that all 34 states will take advantage of this funding opportunity. So that's kind of MFP in a nutshell. And then real quickly, I'll kind of let you know what's going on in the space of the American Rescue Plan Act. There's two things that really do impact or affect the HCBS systems, and one of them is Section 9817 of the American Rescue Plan Act. And what 9817 does, 9817, it temporarily increases the federal matching assistance percentage rate, or FMAP, for states by 10 percentage points specifically for Medicaid, home, and community-based services. And by temporary, we mean between April 1st, 2021 and March 31st, 2022. But a state's FMAP for these HCBS expenditures, it cannot exceed 95% under the 9817 provision. And there's two requirements that for states that states need to do in order to receive the increased FMAP. And so one, states need to supplement and not supplant the level of state funds that would be expended for HCBS that would be in effect as of April 1st, 2021. And secondly, states need to implement or supplement the implementation of activities to enhance, expand, or strengthen home and community-based services. So, we know that states are really eagerly waiting guidance on the implementation of this provision, and or CMS is really working hard to get this information out as quickly as possible. So certainly stay tuned on that. And then the other provision under the American Rescue Plan is Section 9813. And what that does is it did amend Title 19 of the Social Security Act by adding a state option to provide, qualifying community-based mobile crisis intervention services. And this is for a period of 5 years. And that would start April 1st, 2022 and end on March 31st, 2027. And qualifying community-based mobile crisis intervention services, those are furnished to individuals outside of a hospital or other facility setting who are experiencing a mental health or substance use disorder crisis. And the services are going to be delivered by a multidisciplinary team, and they will include screening and assessment, stabilization and de-escalation, coordination and referrals to health, social, and other services as needed. And also the qualified community-based mobile crisis intervention services, those are going to be eligible for a federal matching rate of 85% during the first 3 years of the 5-year period of the state option. And there is also under this provision, under 9813, there is authorization for $15 million in planning grants to states to support the development of state plan amendments, Section 1115 demonstrations, and Section 1915 B and C waiver program requests or amendments for implementing these qualifying community-based mobile crisis intervention services, and also for meeting the federal requirements for the services. And like Section 9817, which is the HCBS increased FMAP, CMS is also working on guidance to implement this provision, and certainly will try to get that information out as soon as possible. So those are the three big areas that I think Jen wanted me to touch on. There's a few other things that our specific division has been working on that I wanted to share with you. One of them is some of the work that we're doing around direct service workforce. And we are doing some work to support and strengthen the direct service workforce through the development of tools, trainings, a state learning collaborative, the development of some resource materials, one of them being an online interactive training for beneficiaries to hire and monitor their own staff. I would mention that the DSW Learning Collaborative, that is actually going to be open to all states in May. So stay tuned for more information or forthcoming information or announcements on the Learning Collaborative. And also our division's work does continue around the HCBS measurement. There's this continued development around HCBS measures. And I think folks know that a set of recommended measures, they did receive public comment back in 2020, and a final set will be coming out in 2021. And then also finally, we wanted to share with you that CMS has put out some new resources that may be of interest. One of them being an LTSS rebalancing toolkit that we did release back in the late fall. And this basically does this layout a lot of information around state strategies to rebalance their LTSS system. And it's a very simple read. And again, I think you can call a lot of good ideas and strategies and ways that states are thinking about rebalancing their systems. We also recently did issue a state health official social determinants of health. And when you're planning and thinking about your LTSS system reform and rebalancing initiatives and ways to enhance and expand your HCBS systems, I think certainly there's a lot of information in this social determinants of health letter that you may find very helpful. It sort of is, there's no new policy in there, but it does sort of compile or kind of serve as a compendium of all of the different ways that states can address social determinants of health under the Medicaid program. Which, many of those, are kind of in the same conversation and space as a lot of home and community-based services when we're talking about affordable and accessible housing, community integration, convenient and accessible transportation, education and supported employment. So certainly would encourage you to take a look at that social determinants of health letter. So I think that's it on my list.
Great. Thank you so much, Martha. We really appreciate you stepping in at the last minute and kind of covering a lot of good stuff. Some good information about resources that folks can use to kind of find out about all the activity that's happening. It's really exciting around some federal interest in really increasing access and expanding HCBS in the state. So really excited to have you. So before we move on to our responder panel, I will just remind folks to please type questions into the Q&A. We will have a Q&A session after the panel, and you can also raise your hand if you would like us to call on you to ask a question directly. So please start to think of those questions so that we can engage you all after our responder panel has a chance to kick this off. So I will go ahead and pass it off to Claire Ramsey, the Senior Staff Attorney at Justice and Aging, to start the responder panel.
Hi, Athena, thanks so much. And thanks for having me here today. I'm sorry, it's just the same moment as the street cleaner is passing my house, so hopefully it won't be too noisy. Thank you, Martha, for that presentation. It was really helpful to hear all the pieces that are coming together around HCBS federally right now. And in terms of Reactor, I think I just want to start by saying, we're all really excited and relieved that the MFP program is being extended and that they've reduced the institutional stay requirements so that more people can benefit from it. And we've definitely seen housing as a continued concern and barrier to people getting out of institutions. Also excited, and I know Joseph will be talking about this later, but to hear about California's work to put the planning grants together, which we have had meetings. So I think just a lot of opportunity there to really strengthen and plan, which is very exciting. In terms of the American Rescue Plan, I'm going to mention a few things. I really recognize that CMS is in a hard position because they both have to explain what's happening while not being able to get ahead of their own guidance. And we are really, really looking forward to what they have to say. And I think there are just a few things that I want to highlight for everyone that I think all of us, the four of us on this reactor panel, talked about ahead of time that we all think is really important to think about. One is just the whole concept of supplement, not supplant, and what that's really going to look like in practice and how flexible CMS is going to be with allowing states to determine what counts in that arena. I think we all definitely want to see California expand and not simply use federal money where it would have already spent state money. But that still can feel complicated, especially when the money's one time and people are nervous to expand things with ongoing costs where they don't know that there'll be ongoing money. The next two things sort of have to do with timing around spending. Again, no one wants to, everyone's very excited about this FMAP increase of 10%. For California, that is a really big deal since we're only at a 50% FMAP right now. Sorry for the noise. But it is a huge amount of money to potentially spend extremely quickly. So just a couple things, and we hope CMS is thinking about this, but whether or not there will be allowance to pay or fund things retroactively back to April 1st, 2021. Since the guidance isn't out yet, and I'm sure California certainly hasn't, but most states haven't figured out how they're going to spend the money yet. And then whether or not it will be states will be able to spend the money past March 31st, 2022, as long as it's allocated by that date. I think that's just been another big concept that people are very invested in, since it's, again, a huge amount of money to spend quickly, and we would not want to leave money on the table that we certainly can use, but that we may not be able to get out the door and spent on services and supports and infrastructure fast enough. And then the last thing I'll just say is, people may know this already, but a lot of us have put in proposals to the state about what could be done with these American Rescue Act Plan supplemental dollars. And there are a lot of ideas. Kaiser Family Foundation put out a brief about this, and estimated that California could be eligible for up to almost $2 billion in extra funds. So, I think people are really trying to think big and think boldly about what the ideas can be. And my colleagues will talk about other ideas, but I just want to mention a couple things that have been put out. So first, really looking at data and figuring out ways for California to both expand what's available. We have a lot of HCBS in managed care, and that data isn't very well understood. Could we pull that data out? Could we start really looking at intersectional data so we have more cross-cutting data on race, gender, LGBTQ status, health conditions, et cetera, within HCBS? There's a lot of places where data could be really valuable, and we could really expand and think about how we could use that to build better and better programs for Californians. We also want to highlight equity within all these efforts. This is something that definitely has been much more at the forefront of our conversations around HCBS. They certainly were when we were having our master plan conversations. So I think, shifting and working toward an equity frame is not a simple idea. Some of that will be driven by data. I think we can also do things like really looking at where our disparities are. We know we have a big technology disparity. How can we improve access to technology so people can take advantage of what's available through telehealth and through other alternative methods of getting services? And how can we really start to bolster our paid family leave benefits and make sure that people are able to equitably take time and care? And there are certainly other ideas that will be discussed, but I just think, you'll hear more about workforce and program investment, but I think we really just have such a huge opportunity, and I appreciate being able to talk a little bit about that. Thanks, Athena.
Great, thanks, Claire. And we will move on down the list here to Peter Hansel, who's the Chief Executive Officer at CalPACE. Peter?
Great, thank you, Athena, and thank you for the chance to be part of the panel today. I did enjoy the overview from Martha. Thank you for that. And I think Claire did a very good job of framing some of the issues that we're thinking about at the state level. PACE, as you know, is a home and community-based program that is called out in the American Rescue Plan. We're very happy to see that. Our program's been working very hard on the ground to help keep people safe and serve them during the pandemic. And we have some thoughts on ways that that role can be extended using these funds. So I think, first of all, I just want to say we're just very encouraged at the direction of the policy announcements, initiatives coming forth at the federal level in terms of what they portend for increasing access to home and community-based services. Certainly, the American Rescue Plan has a good example of that with the increased FMAP. The president has put forward the American Jobs Plan with a pretty significant investment in caregiving and home and community-based services. So we generally think this is a terrific time for policy and hopefully greater commitment to home and community-based services. So we do, as Claire said, believe the state is in line to maybe acquire up to $2 billion in funding and the American Rescue Act funds. We're not sure kind of yet what the state's role and plan will be. We think something will come forward as part of the revised budget. For us, we'd like to see some money focused on helping providers like PACE continue to transition through the pandemic and beyond. So we have put a proposal together for some eligible uses of funds that I think are focused and help ensure that providers like PACE can continue to provide high quality services and meet the challenges of emerging from the pandemic. We know that not everybody is ready to completely go back to normal. We certainly see that in PACE, so we think the PACE model needs some further adaptation. But some of the things we'd like to see funding made available for would be in the area of workforce recruitment, retention, and training. PACE programs have spent a lot of time redeploying staff, retraining them, moving many of the services from the center to the home. Technology enhancements, certainly telehealth and remote technologies that enhance the ability to provide services and care and stay connected and help reduce isolation among beneficiaries, we think have been terribly successful, and we'd like to see ongoing commitment to that area. And also services, in particular, that address mental health issues. And we're seeing more and more of that among our participants, particularly due to the isolation problems due to the pandemic. We share the questions that Claire has framed. We would like more guidance on what does supplement, not supplant mean, and we would like more guidance on whether the funds could be available for activities that are committed to during the time period, not necessarily spent during the time period, but we're very anxious to see the guidance. And I think I'll stop there and thank you again.
Great, thanks so much, Peter. We'll go ahead and continue on with Lydia Misleadis, the Executive Director at the Alliance for Leadership and Education. Lydia?
Hi, good morning, everyone. Thank you, Martha, Claire, and Peter. I support everything that's been said that Claire described in terms of some larger overarching issues and Peter's description of what is needed for PACE. And there's definitely some overlap with our adult day programs and our adult day healthcare programs in California. So thank you for all of that, everybody. So rather than repeating what my colleagues have already described so eloquently, I'll highlight a couple of things that came to mind as we were having this conversation. And one is around the FMAP, in addition to what Claire and Peter have already identified. I think the challenge for us who are in the managed care realm is figuring out how that increased FMAP actually gets down to the provider level, where funds are definitely needed to be able to support readiness to return to congregate services. I think all of you who are listening in today know that CBAS, Adult Day Healthcare, were ordered to decongregate back in mid-March, and we are now in the process of getting centers ready, participants ready, and staff ready to resume regular activities by the end of October. And I think any of you who've been through an emergency understand that it takes a lot longer to recover from an emergency than the time period of the actual emergency. And we're kind of in both right now. We're still in a public health emergency and we're recovering at the same time, or trying to. So we too have some ideas about how funds can be used that will support that readiness of facilities, participants, and staff, and have submitted those to our legislature. It's still unclear how all these different funding sources interact and how they will be able to be allocated in the short period of time that you've described, Martha, particularly for the FMAP. So don't know if there's any flexibility there, but that is a really short period of time to support all of these requests and activities that have definitely led to increased costs of providing care. So I think I'll stop there and be open for the Q&A portion of our discussion this morning.
Great, thanks so much, Lydia. And last on our responder panel, but certainly not least, is Sawait Siyum, who is the Senior Legislative Advocate for Legislation and Communications Unit at Disability Rights California. Wait.
Good morning, everyone. Thank you so much, Athena. My name is Sawait Siyum, and I'm a Senior Policy Advocate with Disability Rights California. I also very much enjoyed the overview of the American Rescue Plan and the discussion. I think DRC echoes a lot of the reflections that have been previously shared by my colleagues. Disability Rights California, as we all know, and maybe some of us don't, but we are the designated protection and advocacy agency for California, mandated to advance the civil rights of Californians with disabilities. Since 1978, DRC has provided critical advocacy services for people with disabilities. We were very pleased to see that the bill includes the dedicated funding for home and community-based services that we've been fighting for since the beginning of the pandemic, along with other important disability priorities. I think we all know that home and community-based services are, and the funding is critical to help individuals with disabilities and older adults remain safely in their home rather than being forced into nursing homes and other congregate settings that have faced severe COVID-19 outbreaks, as we saw this past year. We're also very pleased to learn about the reauthorization of the Money Follows the Person program. As we learned earlier, the program has been operating on short-term funding extensions, which has presented challenges in the provision of these services, which is why Disability Rights California has introduced a bill this session, Senate Bill 281, to make the CCT program permanent in statute. We do have a number of recommendations for the use of the home and community-based service funds, but for the sake of time, I'll highlight a few here. With regards to in-home supportive services, we have a number of proposals. First, we are recommending that we would pilot a backup system for IHSS using Berkeley's Easy Does It model to address the ongoing provider shortages, particularly in emergency situations. We also recommend that we would increase IHSS wages for providers in hard-to-staff cases. Further, that we offer one-time sign-on bonuses for providers in areas where recipients struggle to staff cases. Additionally, we recommend that we make the $15 minimum wage effective immediately statewide rather than wait until January 1st, 2022. And finally, we recommend that the state would cover live scan costs for new providers. With regards to assistive and other technologies, we recommend that we provide funding for assistive and other technologies so that individuals have the option to access remote meetings and services during and after the pandemic. We have some recommendations with regards to the self-determination program. Currently, DDS funds up to $2,500 to support a regional center consumer's initial transition into self-determination. These funds are typically used for the cost of an independent facilitator support in helping a consumer enter self-determination. What we have found is that $2,500 is insufficient to support transition into self-determination for individuals with highly complex needs and high amounts of purchase of service expenditures. So we are recommending that we would provide up to $5,000 to support transition into self-determination programs. And with regards to workforce and employment, we recommend that we support 14C license holders to transform their model through a training and mentorship program, that we also provide increased funding for any employment service provider supporting an individual who previously worked in a sub-minimum wage setting with customized employment. Additionally, we recommend that we would pilot the recruitment and development of new direct service professionals trained specifically to serve regional center consumers in ways that utilize person-centered planning, comply with the HCBS final setting rules, and support consumers' participation in self-determination. We have a number of other proposals, but I think I'll close out with the community-based mobile crisis intervention services funding. As we learned earlier, the American Rescue Plan provides new federal funding for this purpose. And we've seen that mental health mobile crisis teams are highly effective, both as an alternative to the police responding to individuals with a mental health disability and as a way to meet the urgent needs of individuals with mental health disability or substance use disorder. So we recommend that and urge that California would take advantage of these new fundings to expand the use of mental health mobile crisis teams throughout the state. Thank you so much for your time.
Great, thank you so much. Staying right on time here. Appreciate all of those great ideas and thoughtful comments about some of what California is thinking and the advocate community is thinking of hoping that California will pursue using some of this additional federal funding and some additional flexibility and extension of these HCBS programs. So, no good deed goes unpunished, Martha. Since you stepped up to fill in today, we're going to hit you with some questions and hopefully, we will be able to at least get some initial information and follow up with resources as more information comes from CMS about what they're thinking the guidance will be around some of this. But you can hear there's a lot of interest, a lot of good ideas. I think one of the things you hear as sort of a theme throughout the comments from the responder panel was about what sort of one-time capital investments and workforce development, right? So thinking through this supplement, not supplant idea. So clearly thinking about, sort of infrastructure investments or one-time costs that can be done to sort of expand services in a way that makes sense to increase access to HCBS. So, and then additionally, kind of thinking about workforce development and training and some of these things to expand the workforce to, of course, help increase access. So I don't know, Martha, if you have any thoughts or initial reactions to any of what the responder panel had, or any thoughts that you can share around what maybe other states have been thinking of that might be similar or useful.
Sure. Can you hear me? Okay.
Go ahead. Yep.
Yep. No.
Yep.
Okay. Yeah, you're kind of. Like I said, I apologize. I'm having some technical issues, so you're going in and out of that. So hopefully, you'll be able to hear me throughout. But no, I want to thanks everybody for your your very thoughtful comments and suggestions around the 9817, increased FMAP provision. And I will just say that, CMS is hearing from a lot of states and a lot of advocates around these same issues, and that CMS heard these early on. So certainly all of these things are being taken or have been taken, under consideration in the development or as we develop the guidance. And again, unfortunately, I don't have a lot I can share at this moment in time. But I do think that, the kinds of things that have been raised from your four panelists are things that, we are consistently hearing that are concerns, issues, and asks from the states and advocates around how we actually, or how this provision is actually implemented.
Can you just share a little bit more about how you're kind of working with the individual states? Is there like one contact with the state? Like, what's the process for, working to get the states really engaged and get clarity? Is there more insight on that for this group?
Right, to get feedback from states. Well, we have had, I think, at least 2 or 3, sort of all state calls through, national associations, or through some of our state calls on LTSS. So that is one forum, that CMS has been informed around, what states really need and want clarification on in terms of implementing Section 9817. And certainly too, we've heard from and responded to, again, at somewhat of a high level from individual advocates or state or associations and states around expressing their concerns and issues and what they perceive as, as challenges in ways that would be most helpful to have Section 9817 implemented.
Great, thanks. We have a question in the Q&A about if there's a way to tie expanded education on California's paid family leave policies to this funding. There are studies showing that paid family leave reduces nursing home use. Do you think that the CMS guidance might be flexible enough to allow for this kind of funding augmentation? So have there been any discussions about that, Martha?
Well, certainly I will say we're hearing lots of extremely creative, ideas out there. So I would say, continue to be as creative as you can, right? And you're obviously going to be working directly with your states. And each state is going to have a very unique approach and unique needs on ways to address expanding and strengthening their home and community-based system. So again, I think it truly is a good opportunity, a real opportunity right now for folks to really get as creative as they can, and to realize and understand what's going to work best for their state, and then come back to CMS with that.
Great. And do you have any estimate on when more guidance will be coming out?
No, not an estimate, but I can tell you that we are, working around the clock on it. We know, I mean, this started April 1st, we're at the end of April, and we know states are quite anxious and really, quite desperate to have this guidance out. So we are, the entire HHS process is working as fast as it can, I think, to get the information out.
Yeah.
So it is forthcoming.
Great.
Won't come out today, but
won't come out today. Okay. Well, tomorrow. Huh? No.
Tomorrow's another day. Yeah.
Yes, we appreciate that you all are working, around the clock very hard. And it sounds like the idea is to sort of be as creative, as you sort of said, as possible, and see, kind of if you don't ask, you won't know. And then through that, CMS can get a sense of kind of what ideas are out there, what might work best, and sort of being flexible with states to the extent, allowable, of course, given all the rules that you have to follow under federal statute and regulations. But curious if that's sort of the sense that you're getting, that you really do want to hear and see proposals that are maybe a little bit outside of the box compared to what we've done previously with sort of, the set waivers and things that have, guardrails around them.
Sure, and again, I think, CMS certainly is encouraging states to, to work with a broad array of stakeholders to determine, what is going to work, what is needed in each particular state. So certainly, yeah, I certainly, and I think what I can say, yeah, I think that you need to see this as a really good opportunity to really explore what a state can do and needs to do in terms of expanding and enhancing its HCBS system.
Yeah. So there's a comment here in the Q&A about, really focusing on ways to design expenditure plans and for CMS to approve those that include providers that really have the years of experience and understand the local gaps and challenges in the community, and really thinking about, a lot of times, we can dream up in policy wonk, as a policy wonk person, world, what looks like a, great policy on paper, but doesn't necessarily, translate so well on the ground. And so just, I think, sort of a comment to think through, how to really work with the existing community-based infrastructure rather than, replacing it with maybe, funding through managed care plans or other big grants that don't go directly down to the community, where those organizations that have been doing this for decades have some experience. So I don't know if you have any thoughts or reactions to that, Martha, about that. That's a
right.
goal of
And again,
CMS.
Certainly CMS is encouraging, as I said before, states to really engage the full breadth of their stakeholder community. And that, will range from individual Medicaid beneficiaries and their families and their support network system, all the way up to players at the state level. So certainly, states are, CMS is highly encouraging states to really think broadly in terms of their stakeholder engagement, to really ensure that this opportunity really is going to meet and address the unique needs of each state.
Great, thanks so much for that. So I don't see any other questions or anything in the chat. Is there any other questions from our panelists before we let Martha go back and continue working around the clock for us? Okay, well, thank you so much for your time and for stepping in at the last minute. We really appreciate it and appreciate all the hard work. And I'm sure we'll be reaching back out and we look forward to getting that guidance from you. So
great, thank
you're
you.
welcome
And,
to stay and listen, or you can hop off and go back.
actually, I'm going to hop off because I'm doing exactly what you just said I need to go do. So.
All right, thank you so much. We
Thank you for the
appreciate it.
opportunity. Take
Have a
care.
great day. You too.
Bye now.
Great. Well, thank you so much for that. We're going to move right on. So now we have the federal perspective. We're lucky now to have the state perspective and Joseph Billingsley, who's the Chief Program Policy and Operations Branch for the Integrated Systems of Care Division at the Department of Healthcare Services. Quite a title. Is going to give us an overview of the LTSS gap analysis that DHCS has proposed some federal funding to complete next year. So I will pass it off to you, Joseph.
Thanks, Athena, and good morning, everybody. Very, happy and pleased to be able to present and talk with everybody here today. I want to follow up on a piece of what Martha touched on and provide an update specifically on the Money Follows the Person grant supplemental funding opportunity that California is engaging in. So Martha had mentioned CMS has made available to MFP, Money Follows the Person grantee states, up to $5 million in supplemental funding for states to work to plan our, sorry. So stepping back for a second. So CMS has made up to $5 million available in supplemental funding for states that operate MFP demonstration programs, and also to plan on continuing participating in Money Follows the Person grant. And what this money is for planning and capacity building activities to accelerate long-term care system transformation design and implementation, and also to expand our home and community-based services capacity. DHCS does plan on submitting a application to CMS, and the focus of our application, what we're requesting this funding for, is to conduct a gap analysis and multi-year roadmap to facilitate the identification and closing of existing gaps within California's current HCBS and managed long-term service and supports programs and provider networks. We do plan on requesting the full $5 million that is available to grantee states. Again, we're primarily looking on utilizing that funding for the gap analysis and multi-year roadmap, but we have also identified that with any remaining funds after we finalize our the contract with the entity that'll be conducting the gap analysis and roadmap that will be used to provide potentially provide seed funding for new caregiver resource centers or the expansion of existing caregiver resource center services, you know, to help ensure continued or new access to caregiver support services in unserved regions in California. So just to talk a little bit about the stakeholder process that we've gone through, we did want to ensure that we were engaging in a very robust stakeholder process when we became aware of this funding opportunity and started the planning process for it. Really, to ensure that collaboration, we've tried to involve stakeholders the process of the development of this supplemental funding proposal. We started that by holding virtual stakeholder meetings first in December of 2020 to talk about the funding opportunity, to go over, you know, DHCS initial high-level proposal of using it to fund this gap analysis, and getting stakeholder feedback around what that should entail. And then also obtaining stakeholder feedback about other potential uses for the funding. We followed that up with another stakeholder meeting in February of this year to present our proposal. So a more fleshed out proposal of what the gap analysis would be addressing, and provide an opportunity for us to obtain final stakeholder feedback in relation to that proposal that we can include in putting together the final application that is being submitted to CMS. And then also following that piece and throughout the process, we asked stakeholders to provide, you know, written feedback, and we accepted feedback through the end of February for the purpose of informing the development of that application. So just to walk through the purpose of the gap analysis and multi-year roadmap, I want to go over some key points of what we're working to accomplish here. So again, the purpose of the gap analysis is to identify and work to close existing gaps within California's HCBS and MLTSS programs and provider networks, and to build and expand broader MLTSS capabilities. Analysis will provide data and insight to help accomplish the following primary objectives for this that we've identified for this gap analysis. So one being population and provider composition. DHCS expects that the analysis will include a robust examination of the composition of enrollees in the various HCBS and MLTSS programs and delivery systems across the state to define who's receiving which services and where, and also with the intention of identifying inequities in access to and use of services. It will also include a statewide comprehensive provider assessment to identify service capacity, highlight specific regions or locales that require additional access to services. The second objective of the gap analysis is unmet need. And so for this point, the analysis will assess unmet need for HCBS and MLTSS, looking to compare today's service mix and utilization by county or regional level with the desired core service mix and capacity access. It will also assess changes to reimbursement rates and payment methodologies to expand HCBS provider capacity and improve service quality while using standardized metrics to measure performance. Third is coordination of care. The analysis will work to identify gaps in the intersection between HCBS and LTSS providers and managed care plans, and identify solutions on the path towards the long-term goal of integration of MLTSS. It will also identify gaps and opportunities for increased collaboration and partnership with providers, addressing other social determinants of health like housing and food security, and assess pathways for increasing coordination with and supports for unpaid caregivers. Fourth focus of the gap analysis is quality measurement and monitoring. So the analysis will examine current capabilities and gaps in California's approach to quality measurement and monitoring HCBS and MLTSS programs and services to identify opportunities for improvement and work to achieve consistency across program models. And then lastly, the last key point of our analysis is single point of entry system. The analysis will identify gaps in the intake and enrollment process to help potentially create a more streamlined procedure so that eligible clients can find what they need regardless of which provider program or system of care to contact first. So that's like again a high level overview of the key objectives of the gap analysis and multi-year roadmap. That was included in what we did share with stakeholders in February and is what we utilized in building our application for submission to CMS. I think it's important to note too that DHCS goal is that another key goal for this gap analysis and multi-year roadmap is that it continue to build on current work within the state. So it's really necessary to recognize work that's already been done and being done. Particularly things like California's Master Plan on Aging, as well as the CalAIM initiative, to assure that we're achieving alignment there with those other stakeholder processes. And then, just in line with accomplishing this, so throughout this process, in addition to, working very closely with external stakeholders, we've also been collaborating closely with other state departments, both within our Health and Human Services Agency umbrella, as well as departments outside that would be responsible for key interrelated aspects of the gap analysis, like our housing departments. So currently, the the application is going through the review process for final approval for submission to CMS. As Martha noted, we have until the end of June to submit that. DHS is currently aiming to submit the application by the end of May. And so that will be the next steps. Once the application is submitted, it will be posted to our DHCS website, and it'll be on the Money Follows the Person, our California Community Transitions page. We currently already have the proposal that was shared during the February stakeholder meeting posted, and we'll be posting the application there as well upon submission to CMS. So I'll go ahead and stop there, I think, and see what questions we have.
Great, thank you so much. Lots of moving pieces. We appreciate the update. There was a question about when we can see the proposal, and I think you just answered that, and that, you know, the draft is up and there's the final proposal will be posted hopefully in late May, early June when that gets submitted. So we will keep an eye out for that. And then there was a question about if during the gap analysis, if needs are identified there in addition to sort of caregiver needs, would the additional funds be available to address those additional needs? So I guess the flexibility in how you're gonna fund what is identified in the gap analysis.
Well, I think it's important to note that that while one definitely you know, as we're going through this process and working through through stakeholder input, if as part of this process we identify that there are alternative uses for any remaining funds, that there are options for pursuing that, but there is a process behind that. So for this application process with CMS, we have to clearly identify what the funding is being used for. And so we're actually doing a multi-part application process that identifies that the primary purpose of the proposal is to address the gap analysis and multi-year roadmap. But we are also submitting a secondary proposal identifying that we would use remaining funds for these specific purposes related to caregiver resource centers. Again, if we were to update that or want to make changes to that, then that involves a supplemental budget request process with CMS. So yes, there are avenues to changes later in the process. It would just require work with CMS to do so and approval.
That's helpful. We have another question about if the money that's coming from the American Recovery Plan, which we heard about earlier, does that affect anything about the gap analysis or the roadmap? Is there anything like, oh, well, now we can use this funding that's coming, from some of this stimulus relief packages or increase in FMAP to fill a gap. Therefore, we won't focus on that in the gap analysis or the roadmap.
No, I mean, definitely, I think, the department continues to look at, where there's new funding coming in and how that funding can potentially be used, right? So definitely we continue to monitor that. We're very anxious, we've provided input to CMS as well and anxiously looking forward to their additional input on, specifically how the American Rescue Plan Act funding can be used and what are going to be the rules around that. But I think it's important to note that this supplemental funding grant opportunity provides us with a very specific goal and purpose and something that we can use this specifically for. And I think that'll help build towards the work that we're doing to identify how these other funding sources can be used, right? And while definitely from an American Rescue Plan Act perspective, it's that is very time limited, although again we're still waiting to really understand from CMS how that can be used and how those timelines will work. But there's been a lot of talk around other HCBS funding and initiatives that the Biden administration is looking at. So I think this will be very key in helping the department to work towards, identifying, how those funding sources can be used and properly applied toward the objective of really expanding and building our HCBS capacity. I think that really layers in nicely with that process.
Great, thank you. So just a little bit more on sort of the timeline, the big picture. So you've got, you've got the proposal going at the end of May, assuming it gets approved. I know there's an RFP process to get a consultant to come in and do the actual analysis. Can you just do a high level timeline for us on that sort of roadmap and timeline?
Right.
I know I've
So
seen
again,
it, but.
Right. So yes, again, we're working to get the application submitted. Then we're going to be, once we do that, we're working on the RFP process, putting that together so that we can put out a request for proposal, work through that process to identify a vendor. Our goal is to get that process initiated immediately. And so that we will be able to basically initiate the RFP process as soon as we have CMS approval. We don't have real clarity on the length of the approval process from CMS. We're hoping that it's going to go quickly and that potentially they're looking at providing approval within the current federal fiscal year. But again, we don't have specifics on that piece. So, but our goal is to be able to initiate the RFP process as soon as we have approval from CMS so that we can complete that process and really get this gap analysis in motion by the beginning of next year.
Yeah, great. And so following on that, I know that the collaborative has been really interested in thinking through, you have kind of the roadmap and the things you want to include in the gap analysis, but getting down to some of the details of what that would really look like with some input from stakeholders. So is there an opportunity to think, for us to, for stakeholders to engage with you on the development of the RFP and what kind of goes into that? Because of course, what goes in influences what comes out on the other side and what you're going to expect from the consultant that ultimately does this heavy lift?
I think that's a great question and something that we'll continue to look at and work through. We've found it very important to have stakeholder input throughout this process so far. And so I think that as we work towards building that RFP, definitely there will be opportunities for us reaching out for stakeholder input, and we'll want to continue to work with the stakeholders that have been key to this process today.
We'll definitely look for some of those opportunities. So I don't see any other questions in the chat or Q&A. Do you have any other last thoughts or questions for us on how these can be helpful in this stakeholder process or as this moves forward?
No, I just want to thank everybody for your time. I know many of the folks on this call are people that have also seen involved in that stakeholder process for this supplemental funding opportunity, as well as other things that we're working on, like our HCBA waiver renewal. So a lot of familiar faces and names, and I just appreciate the input and feedback that you've provided so far in this process. And we will continue to look forward to and appreciate your input as we continue moving forward. So really appreciate your time. Thank you.
Great, and same to you. We know you're very busy as well with everything coming down. So thank you again so much for sharing this information. And I'm sure we'll be reaching out again for updates as this all moves forward. So again, you're welcome to stay and join the rest of our panel or head off to get back to work. But we want to thank you again for your time and all of your insight.
Thank you.
Thank you. So heading into our last session or portion of the agenda here, we're lucky to have an update on the launch of Alive Ventures Elder Advisory Committee. And so I'd like to welcome Lauren Miranda, who's the community manager at Alive Ventures. I will hand it off to you, Lauren.
Hello, thank you. I can't turn on my video. I think it says.
I think Maria can turn you back on.
Wonderful. And I have some slides as well. Athena, can you help me run those? Perfect. All right. Hi, everyone. Thanks so much for having me with you today. It's a joy to be here. As Athena mentioned, I am the community manager at Alive Ventures, and I'm here to share a bit more about what our organization does and how we engage with older adults, and how we create services and experiences that amplify the joys of aging, and an exciting opportunity that we just launched for our Elder Advisory Committee. But I wanted to start with a bit of a background of what it is that we're doing and why we're doing it. Before we founded Alive Ventures, we traveled the country spending time with the people who've lived the longest, and learning about what makes them come alive. And what we saw from talking to older adults is that there's such an incredible vibrancy. There's a wisdom about life, and not just in the sage, stroke your beard kind of way, but in everyday ways. And we learned that older adults are hungry for beautiful products and services that empower them and help them nurture active day-to-day experiences of love, work, vitality, and friendship. And they have the most experience being alive, and we can learn a lot from them about how loving, living, and making friends changes in later life, often for the better. So here's a few examples of what we learned. We learned that getting older, choosing to retire, or decreasing your work hours doesn't mean you have less value or expertise to offer, but it means that older adults need dynamic structures and new opportunities to share their skills and wisdom in a way that meets their needs now. We learned that older adults need spaces that encourage mind over body, spaces that reinvigorate and honor one's vitality, especially as we're living longer these days. Our community of older adults also told us that as we get older, we lose many of the social structures, such as school and work, that allow us to easily meet and make new friends. And therefore, older adults need new solutions that not only bring them together over shared interests, but solutions that foster deeper, more meaningful connection and the type of friendships that help to combat loneliness and isolation. Our community also told us that they're interested in falling in love too, not only with a partner, but in falling in love with themselves and finding ways to nurture all types of love in later life. In many of our community interactions, older adults actually expressed how important self-love was, and that if you don't love and respect yourself, it's hard to love or be loved by someone else. So we believe that older adults deserve great brands and great products and great experiences too. And no matter how we may appear to others, sick or well, physically limited or not, they yearn to have their wants and needs met and not defined by the needs that others would ascribe to them. This is what it means to be alive at every age. So after learning all of this, during this research, our team then surveyed the landscape of innovation happening for older adults to learn more about what types of businesses are being created for the older adult market. And what we learned is that among the new products and services that are out there, most of them tend to focus on responding only to the negative aspects of aging, like reduced mobility and increased independence on others. And these solutions often begin with someone else's idea of what older adults want and what doctors think and what caregivers hope for, and also what corporations wish people would use. And we know that this isn't working for anyone. So, envisioning a society that doesn't see aging as simply a burden to be accepted, but a unique phase of life with particular joys, perspectives, and relationships to be nurtured, the SCAN Foundation created Alive Ventures to enable and inspire innovators to create new offerings that embrace the beauty of life as we age and enrich the lives of older adults, families, and communities, encouraging innovators to design with older adults and not just for them. So in summary, for what I just shared, the problem is that there's really few companies dedicated to creating joyful and desirable products which enhance later life. Instead, many companies continue to treat aging as a problem and tend to focus on responding to the negative aspects. And our mission on Alive is to radically transform the ecosystem of products that enhance the joys of later life. And our solution to doing that is in designing for older adults with older adults, giving them an active voice in developing the products and services that can better serve them and ultimately everyone. And our approach to doing this is inviting older adults into the design process with us. And this sounds so simple, but it's so significant. We've formed the Alive community to gather those who wish to help us design new experiences that magnify the joys of later life. And together we're learning what inspires older people and drawing from that inspiration to create meaningful brands created uniquely for them. So the value of our community is unique in many ways, in that it fosters connection, and it reduces isolation and offers stimulating engagement. It helps older adults connect with like-minded individuals, form bonds, make friends. And members also get to learn new skills and experiment with new technologies. And they're able to help people like themselves and find more joy in later life, as well as contribute to positive social change. So I'm here to invite you and your communities to join us as we shift the narrative on aging. And some of the ways that we engage with our community of older adults is to offer opportunities to participate in both paid and unpaid opportunities to share their voice and be heard. There's opportunities to attend many different unique and free events. Everything is free in our community. They can participate in one-on-one conversations with us to share their story, share their experience, their wisdom, their thoughts, feedback, needs, and desires. They're able to reflect on new ideas and experiment with new concepts. And they're able to participate in exploratory workshops. We call them co-design sessions, which are really deep dive into topics where we explore, reflect, and co-design unique and empowering solutions to help them, move forward in a particular way. And then there's also the opportunity to offer feedback through advisory opportunities, which is what brought us to our newly launched Elder Advisory Committee, which is a 3-month program in which we bring on board 12 to 15 older adults to join us in an advisory capacity. And this is a paid role. And they connect with us every 2 weeks for an hour to give feedback and thoughts on what we're creating, to share their thoughts and experience, to bring their own life experience into the process, and to be part of our team. So we rotate that every 3 months. We just started our first cohort at the beginning of April, focusing around our topic of love. And so our committee is sharing all of their perspectives and thoughts and experiences around the many types of love as we create different services and experiences related to that. And then in July, we'll launch our next cohort, which will probably be focused on work or vitality. And so we'll send out a call to invite another group of about 15 older adults to join us on that advisory committee. But in between, there's all these other opportunities that we reach out and connect with older adults and engage them in this process and invite them into an active role to shift this narrative on aging. So I'm curious to kind of see if any of you have any thoughts on this, or if any of this would resonate with your community, if like one-on-one conversations and workshops and advisory committees is something that would be interesting to them and that they would be wanting to engage with this, as well as answer any questions. So thank you all for your time.
Great, thank you so much. And we have in the Q&A a yes, yes, and yes from Debbie, who's always enthusiastic, and said, could you imagine if education stopped 7th grade? We should do that with aging. I love this. So I think there's definitely support for this, and it looks like you have some information here, and we can also share out, if you're open to it, your email with the group or contact information if they want to provide more. But we do have a few minutes for folks to share, but I know this is kind of right in line with a lot of the work that Collaborative does about helping people, thrive and age in place and in the community. And so really excited that you were able to share some of these pieces. So I will see if our responder panel specifically has anything. Definitely interested. We got from Carol, and she's got her email in there for you to grab from the chat. You all can follow up. Does anyone else have thoughts or questions for Lauren or reactions?
Athena, I can also share a couple of one-pagers on some of these specific opportunities, if it'd be helpful. I don't know if there's a mailing list, or the deck is here as well. So.
Yes, yeah, we will. The materials will go out with the agenda, and we can also, if you want to send those to us, Maria and Nancy can make sure that those get out to the group. So this will be great for folks to take back as they're working. So this is really helpful information, really exciting, and there's definitely I'm sure a lot of interest from this group specifically about how it can help those that they work with on a daily basis. So any other last thoughts or questions from the group? Not seeing anything pop up, but we will definitely get that information out. You've already got 2 folks saying that they're definitely interested, and we have just that this was really a great topic, and we appreciate you coming and joining us.
Yes, thanks for having me.
Yeah, thanks so much. We appreciate it. And I think that brings us to the end of our agenda. So thank you so much, everyone. We had a nice full agenda today. We covered a lot, and we look forward to seeing you at our next monthly webinar. Thank you so much.